many older Americans are without an advanced care directive plan for the needs that they may have at the end of their lives. Medicare has introduced a billable program called Advanced Care Planning, or ACP for short, to address this situation. In this video, we'll review what an ACP involves, as well as how it can be beneficial to your patients and to your practice's bottom line. Hi, I'm Lauren from ThoroughCare. At ThoroughCare, we've helped clinicians and practices implement advanced care planning with our care coordination software solution. Advanced care planning, or end-of-life planning, is a difficult task to undertake. It may involve uncomfortable conversations that are not always top of mind for patients. By working with your patients to create a plan, you can help their family navigate the challenging decisions they may have to make. Also, an advanced care planning discussion can provide your patients with the confidence that their healthcare wishes will be fulfilled. So, let's review what an ACP involves, its CPT billing codes and reimbursement rates, as well as how it can be included with an annual wellness visit. What does an advanced care planning talk involve? The core component of an ACP is explaining and thoroughly discussing what advanced care directives are. This is known as a living will. A living will is a legal document that can specify the patient's care preferences in the event that they are incapacitated. This can include different end-of-life decisions, such as performing CPR in a stopped heart, dialysis, tube feeding, mechanical ventilation, or organ and tissue donation. Advanced directives must be set in writing. Different states have different regulations regarding their creation. Some states require the completion of a standard form or require a witness or notary to be present when a patient signs such a document. Before providing your advanced care planning consultation to your patients, double-check and ensure that you understand your state's laws regarding these advanced directives. To provide and bill for ACP services through Medicare, it is not required to complete or attempt to establish this document during consultation. All that is necessary is explaining and discussing this resource and ensuring the patient understands their options. In addition to reviewing advanced care directives, ACPs must include a few other aspects determined by the service's two associated billing codes. The first CPT code that you need to know is 99497. To accurately bill for code 99497, services must allow for 30 minutes of face-to-face consultation with the patient, their family members, and/or a surrogate, all with a minimum of 16 minutes of service time documented. This should record that the ACP conversation was voluntary on behalf of the patient, describe what was talked about, who was present for the conversation, and note the length of time for the consultation. The ACP must be provided by a physician or other qualified healthcare professional. It must include an explanation and review of advanced care directives and options for completing them. Again, it is not required to complete an advanced care directive during ACP. Completion is only required if you've noted in your documentation that you performed this task. The current average reimbursement for CPT code 99497 is about $85. The second billing and add-on code is CPT code 99498. This is an additional add-on to allow for an additional 30 minutes of ACP services. Requirements for this CPT code include listing this billing claim separately in addition to the code for the primary consultation, and that a minimum of 16 minutes past the first 30 minutes is documented using the same documentation requirements we previously spoke about. The 99498 current national average reimbursement rate is about $76. So when is a good time to present an ACP discussion? An annual wellness visit is a yearly assessment given to your patient and is a perfect time to cover why advanced planning can be a great benefit to a patient and their family. An AWV reviews a patient's medical history and identifies relevant preventative services. Advanced care planning discussions can be one of these such offerings and can be done during an initial annual wellness visit or a subsequent annual wellness visit. For patients covered by Medicare Part B, when advanced care planning is provided on the same day as an annual wellness visit, patients are also eligible to receive this consultation without the need for a deductible or co-insurance. This benefit can help make the service more appealing to your patients. During the annual wellness visit process, it could be helpful to ask the patient if they've had an advanced care directive or power of attorney. This question can spark the conversation and allow you to gauge the patient's advanced care planning needs. Approaching your patient about ACP can be a difficult task, but it is an important topic. It can greatly improve end-of-life care for an individual and their family. With an AWV, your practice can more seamlessly address its patients about ACP and provide consultation. An AWV program can also help you improve overall patient engagement and maximize clinical efficiency. If you'd like to learn more about advanced care planning and annual wellness visits, please visit our Learning Center. There's links in the description below. Or if you're interested in care coordination software and how it can help you coordinate an annual wellness visit program by providing advanced care, then contact us at the link below in the description. Please like this video and subscribe to our YouTube channel for all of the latest care management updates. Thanks for watching, and we'll talk to you soon.